Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant. This week is my favorite vlog that I'm going to do because my shoes and socks are off. So obviously we're going to talk about the feet. Actually the feet are one of the most interesting things to adjust. They're my favorite thing to adjust, believe it or not. Just hearing a foot adjustment's crazy impressive, and patients get a lot of good relief from it. So this week we're going to just talk about the foot, the anatomy of it, some different conditions and what we can do to help. So what I'm going to do is I'm going to have my camera lady actually zoom in on my feet a little bit. I'm going to explain the anatomy of the feet. So I'm going to bend down real quick and I'm going to have her zoom in on my feet. So the foot consists of 26 bones. You have a heel bone, which is called the calcaneus. You have an ankle bone, which is called the talus. You have 5 smaller midfoot bones. This is the midfoot right here. These are what make up the arches. And then you have 5 metatarsals, and then you have the phalanges, or the toes. There's between all these individual toes, there's 14 little bones within that. So it makes up your 26 bones. Now you have joints in your feet as well. You have 33 joints in the feet. So what these joints allow you to do, and I'm actually going to have her zoom back up on me. I'm going to take a seat real quick. These joints in your feet and your toes allow you to do something called dorsiflexion, plantar flexion, and then your toes, flexion, extension. And you can also do abduction and adduction of the toes, like bring them out, bring them in, and also a little bit of circumduction. I can't do circumduction, not a lot of people can. And then 2 other motions as well. You have inversion and eversion. So those joints allow you to do that in the feet. So next thing I want to talk about is I want to talk about different conditions that can be treated with foot problems. So I'm going to have her zoom back in on my foot here. The first condition I'm going to talk about is called metatarsalgia. So right here are the metatarsals right here that I just talked about. You have 5 metatarsal bones here. What metatarsalgia is there's inflammation within the metatarsal bones right here. That's due to excessive running, excessive trauma, high impact sports. How do you treat metatarsalgia? The RICE protocol: rest, ice, compress, and elevate. And another good thing is have a good supportive shoe. Okay, so I'm gonna have her zoom back in on me. The other conditions that we can treat, we have something called tarsal tunnel syndrome. Tarsal tunnel syndrome is when the tibial nerve, which is a branch of the sciatic nerve, so the tibial nerve actually starts here and runs around to the front and controls everything in the front of the leg and the feet. Whenever that's pinched, that can cause pain in the foot region. So in tarsal tunnel syndrome, there's more mild cases and there's more severe cases. Flat feet, high arches, those are more common things. Fractures, but you get more severe cases like neuromas or anything like a lipoma or some sort of benign tumor that can put pressure on that tarsal tunnel there, which can mean, you might need surgery in that case, but those are more severe, more rare cases that we tend to see. Now we've talked a little bit about your neuromas here. So what's a neuroma? A neuroma is a little benign tumor, or a lipoma, which is a fatty tumor. Those are different types of tumors. What they are is they put pressure on a nerve. They are completely harmless. They're not cancerous, anything like that. What it can do though is if it can grow and it can cause pressure on that nerve root even more. Sometimes in those cases you need to remove them. But if they're not a problem for you, some people just live with them. They don't really affect them too much. Last thing I'm going to talk about is congenital abnormalities, and there's a whole bunch of them out there, but the 3 most common are flat feet, high arches, and then a bunion. Okay, so obviously I'm not an artist. You guys have seen my drawings in the past. So here's what a foot should look like, and again, it shouldn't really look like this. Just gives you an idea what it looks like. Your foot should have a little bit of an arch. Okay, that arch is to help with repetitive stresses. It's like a shock absorber, just like your disc guard in your back. Then you have something called flat feet. Flat feet are typically due to trauma or it's congenital. There's a lot of people who have flat feet, and then you have someone with high arches. High arches can be due to traumas, but most commonly, high arches are due to more severe neurological conditions that we see when you're born. You know, people with cerebral palsy, different types of neurological disorders that you're born with. A lot of people tend to have higher arches there. So what do you do in these cases? Get a good pair of shoes. Make sure you're doing the RICE protocol. But the biggest thing is get a nice pair of shoes and get a good pair of orthotics. And those are things I'm going to talk about in a few weeks. So can you adjust these patients? Absolutely. So what can we do to help is now the question. Again, chiropractors can adjust every joint in the body. I adjust feet. I do like adjusting feet. And I think it's very important. But what we're going to do first, before we look at the feet, is we're going to look at the back, because in 90% of the cases, it is coming from the back. But you know, if I'm starting to see patients who are having issues with their feet still, not getting any better, you know, I have a good shoe company in the area that I can recommend. I have orthotics that I sell that we'll talk about in a future blog. And again, I'm going to adjust the feet for sure. So those are the things that we have to offer. Now, you may have noticed we didn't talk about plantar fasciitis. That's one of the most common foot conditions that people see. Plantar fasciitis is perhaps one of my favorite things to adjust. I just find it very helpful that a chiropractor can help with plantar fasciitis. So next week, I'm going to talk a little bit about plantar fasciitis, and then the following week, I'm actually going to talk about proper footwear and the orthotics that we sell. So if you have any questions in the meantime, feel free to reach out to me. I'll be happy to answer any questions. Otherwise, I'll see you in next week's video when we talk about plantar fasciitis. Everybody have a good week.